I'd like to discuss with you a procedure called the pinhole surgery. Have you ever looked in the mirror and when you smile in the mirror, you've noticed that your teeth are starting to look a little bit longer? Maybe when you eat ice cream or you drink iced tea, you have some teeth that are starting to become cold sensitive. Those are all signs that your gums are receding. And today we've got new approaches to manage gum recession that are far different than what we've had in the past. In 1986, the very first types of graft procedures came onto the market to cover up recession. They were called connective tissue grafts. They were invasive surgeries. You might have heard, or you might have talked to somebody who's had some type of grafting like that, and they'll tell you, oh my gosh, where they took that tissue from the roof of my mouth, it hurt for 2 weeks. Today, we can do a procedure called a pinhole surgery. We literally operate through a pinhole. We can cover up the recession. There's no donor site in the roof of your mouth. And you can see the results the same day I do the procedure. The great thing about it is that it's so minimally invasive. There's little or no swelling, and there's little or no pain with this type of procedure. So when you walk out of the office, one, you can smile and you can see the result, but two, you don't have that recovery that you would have had if you had the connective tissue grafting that's been the gold standard for so long.